asking everybody to wear a mask.
So he'll need to do what everybody else is doing, which is scan. Does he have a phone and headphones?
I'd like to make a quick announcement. We'll be starting the news conference shortly, but there will be French and English interpretation for this session. If anyone needs, if you can please use your own headset and your own phone, I can tell you how to do that. There's a QR code up on the screen that if you take a picture of the QR code or scan the QR code, that'll take you to the site. And then you will see there are options. There is a floor feed, and then there's an English feed, and there's a French feed. I would recommend that depending on your language of preference, you choose English or French, and it will follow through the entire presentation that way and allow you to hear real-time interpretation. I'm sorry?
Can you change to French for someone because the names are
Hello, how's the interpretation working? We're testing the interpretation. Testing, I think it's working. Wonderful, thank you, and apologize for the delay, everyone. Good morning. Welcome to today's news conference organized by FP 2030, where our speakers will provide updates on FP 2030 commitments that have been made in the past year, some of which are being announced this morning, as well as present new data on the use of modern contraceptive use around the world. My name is Catherine Davis, and I'll be your moderator for the news conference this morning. Before we start, I would like to ask everyone to please wear a mask. It looks like we do, and I appreciate your cooperation. We do have some reports of COVID-19 in the community, and we want to ensure that everyone is staying as safe as possible, so thank you for your cooperation. It looks like, does everyone have, as we've mentioned earlier, this news conference will be conducted in English and in French, and interpretation is available. Does everyone have headsets and have understood how to use the QR code? If you need any assistance, feel free to raise your hand. One of my colleagues will help you. We do have QR codes that we can pass through the audience as well. Okay, and today I'll be introducing our speakers in a moment. Our speakers will each make a brief statement, and then we will open the conference to questions from the media, both in person and virtually. Media are welcome to quote directly from today's news conference, and all content is available for immediate release. We do have a press release as well as a brief of the report that we will be discussing today. Those are both available. Please come and see myself or one of my colleagues after the briefing if you did not receive those already. They are also posted for our registered media. Please know that everything is posted in the online newsroom. The news release went live today at 10:30 a.m. So before we begin, I would like to briefly introduce today's speakers. First, I'd like to introduce Dr. Samu Kiliso Dube. She is the Executive Director of FP 2030. Dr. Dube joined FP 2030 after a career in private sector healthcare enterprises. She is a physician by training, and her career began in maternal and child health programs, leading up to her leadership as the Africa Program Director of the Global Campaign for Microbicides at PATH, a global NGO focused on innovations that improve health equity. Dr. Dube's experience with global NGOs, philanthropy, and entrepreneurship make her uniquely skilled to guide FP 2030 as it expands to better support a global partnership, ensuring a smooth transition to a new model centered around regional hubs and driven by country leadership. We also have Jason Bremer, who is FP 2030's Senior Director of Data and Measurement. Jason has more than 15 years of experience providing technical leadership on research translation, policy analysis, data for decision-making, and individual and institutional capacity building. He also has a wealth of direct country experience in many of the FP 2030 focus countries, including Ethiopia, Kenya, Nepal, Philippines, Rwanda, Tanzania, and Uganda. Next, we have Dr. Atul Gawande, who is the Assistant Administrator for Global Health, USAID. Dr. Gawande is a renowned surgeon, writer, and public health leader. Prior to joining the Biden-Harris administration, he was a practicing general and endocrine surgeon at Brigham and Young Women's Hospital and a professor at Harvard Medical School and the Harvard T.H. Chan School of Public Health. And finally, we have Dr. Jean-Jacques Mbungani Mbanda. He is the Minister of Public Health from the Democratic Republic of Congo. So without further ado, I will hand it over to Dr. Samu. Thank you.
Thank you, Kirsten. Ladies and gentlemen, as Kirsten mentioned, my name is Dr. Samuel Sodube, and I'm the Executive Director for FP 2030. Oh, things are falling apart here. Something that should protect this microphone is falling apart. So FP 2030, ladies and gentlemen, is the only global organization that focuses solely on family planning. And that singular focus allows us to bring together the widest possible range of partners across disciplines, sectors, and that makes us situate family planning at the crossroads of global health, development, and gender equality agendas. I'm thrilled to be here with you this week. Over the past 10 years, even though we have seen many obstacles for country health systems, for you as individuals, actually, if you recall from COVID-19, the global pandemic that affected us all, natural disasters, some of you hailing from Pakistan, and some of you understanding what is happening at COP27, armed conflict in some of the countries, yet through it all, we have seen women and girls everywhere in need and wanting more contraception. We will see in our numbers today that they've continued to seek out and use modern contraception in ever-growing numbers. You will hear from my colleague, Jason, about how much that demand has steadily grown since 2012. We have an estimated 371 million women of reproductive age using modern methods of family planning, 87 million more than a decade ago. We have said previously, these numbers mean more than the numbers, because for us, they mean saving lives of 140,000 women from maternal mortality and 28 million unsafe abortions. Women and girls, ladies and gentlemen, seek out modern contraception because it is the key that unlocks many opportunities in their lives. Think of the young adolescent girl. Earlier on, I mentioned that adolescent girl as my daughter, Matilda, whose future depends on delaying childbearing until she can finish school and start a career. Think of the young mother for whom adequate bed spacing is literally of the difference between life and death in her life, for her and her babies. Think of the hard-working farmer in your village, or even in the peri-urban setting, or the business owner, this entrepreneur who relies on contraception to keep her world on track, feeding her family, sending her children to school, lifting herself and a loved one out of poverty. It is important, ladies and gentlemen, to stay focused on this important agenda. Women all over the world, they want to be safe. They want healthy lives, and they want control of their lives, which for so many decades we have sought to actually control. And for me, this is unfair. We're at a pivotal moment, ladies and gentlemen, in history and the world. It needs to step up to ensure that we can meet this ever-growing demand. None of this should be controversial, but often it is, because at a fundamental level, access to family planning is about shifting power, which is about expanding the ability and freedom of individuals to make sure they can exercise choice and agency in their own lives. We are encouraged by the dozens of actors who are part of our movement, who share our passion, who make sure that they are already committed and they continue to commit to expand access to family planning. But now is a time to be bolder. It's a time to go build bigger. It's a time to lead, to create a world that doesn't exist now. Leadership for me is doing. Leadership is being intentional, making the promise that you will make the world better for women and girls. For the past 2 years, funding for family planning has been essentially flat, but substantially lower than the peak that we achieved in 2019. Given the current financial situation, instability, inflation that we see in our countries, there could be further funding cuts in the future. But we need to hold. Failing to adequately fund family planning would be a missed opportunity for millions of women. We need not only to hold the line, but also secure new sources of funding and to use the funding that we currently have more effectively and more efficiently to accommodate the surge in demand that we are seeing in family planning. To ensure that the world stays on track to meet the Sustainable Development Goals for 2030, including the intersecting goals of gender equality, health and prosperity, investments in family planning must be safeguarded and they must be strengthened. Because ultimately, we cannot talk about meeting any of the Sustainable Development Goals the world has set to achieve without talking about family planning. As we sit here today, for example, we know that scientists, indigenous people, local communities, and world leaders meeting in Egypt for COP27 are desperately seeking solutions to the climate crisis. Those discussions must not only include and involve women in a meaningful way, they also cannot overlook the importance of reproductive health, services and rights, and the transformational power of family planning. In my own view, we need to move the world alongside of family planning saves lives. For me, it not only saves lives, it also transforms lives. Our gathering here today provides us with that opportunity, which is unique. It's for an opportunity to reflect, reimagine, and challenge each other, challenge the status quo to ensure that everybody put all hands on deck for a renewed sense of determination and energy for family planning. We owe it, ladies and gentlemen, to women and girls all over the world who are demanding control over their bodies and the ability to share their destinies. A great deal of work lies ahead, but I am heartened today by the incredible strength and resilience of this community amidst all inflation, floods, even what we have seen from COVID-19, because we are still holding that power. Thank you very much, Kirsten, and we hand over to Atul.
Thank you, Dr. Dubé. And next, I'd like to introduce Dr. Atul Gawande from USAID to provide his statement.
Thank you all for coming. I see they have an ambulance out here, and I'm glad because I'm sure that what I'm about to say will shock you. I'm Atul Gawande. I lead global health at USAID, and I'm pleased to announce today that the U.S. Agency for International Development I'm announcing our support for FP 2030's goal of building a future where women and girls everywhere have the ability to lead healthy lives and make voluntary, informed family planning and reproductive health decisions. USAID will commit, we're announcing today, $15 million in funding, subject to availability, over the next 5 years for the FP 2030 partnership. Throughout this award, USAID will provide global leadership and state-of-the-art family planning technical assistance to support FP 2030's goal of advancing access to contraception for millions of women and girls around the world, including in USAID priority countries. USAID is proud to be a significant technical and financial contributor in the FP 2030 partnership. It's the world's only global alliance aimed at empowering women and girls by investing in rights-based family planning, and was a founding member of its predecessor, Family Planning 2020. So we're incredibly proud to be supporting this partnership. Through this award, USAID will support and advance locally led development through partnerships with local networks and organizations, and we will co-fund the FP 2030 support network consisting of regional technical resource hubs in Africa, Asia, Latin America, and the United States. FP 2030's commitment to equitable and rights-based approaches, country-led leadership, inclusion, and transparency aligns with USAID's localization agenda and offers USAID enhanced opportunities to engage with local partners in support of women's reproductive health around the world. USAID's partnership with FP 2030 also supports broader U.S. efforts to advance gender equity and equality and promote the sexual and reproductive health and rights of women and girls. As the world's largest donor of bilateral family planning assistance, USAID proudly supports voluntary family planning and reproductive health programs in more than 30 countries. Today, as a result of USAID's investments in voluntary family planning and reproductive health programs, millions of women and couples around the world are able to choose the number, the timing, and the spacing of their pregnancies resulting in significant social, economic, and health gains for themselves, their families, and their entire communities. With that, I thank you, and I will apologize that I have to catch a flight, and so I'll be unable to stay for the question and answer portion, but I'm grateful to my colleagues for carrying on.
Thank you, Dr. Gwande. Thank you for joining us. Next, I'd like to hand the floor to Jason Bremer of FP 2030.
Thank you for the opportunity to join you and share insights from this year's FP 2030 Data and Measurement Report. Today, I just want to whet your appetite and encourage you to explore the depth of data and analysis that exists in this year's summary brief, which is a print material that can be distributed to you, the data resources that are now launched online, which provide indicators for 82 low and lower middle income countries on a variety of important and key family planning measures of progress, and country data sheets so that you can explore specific countries, including that of the minister here, the Democratic Republic of Congo, so that you can see the progress made in specific countries. I like to refer to the measurement report as just the icing on the cake. It represents the rich data conversations that happen each year in countries where measurement partners, FP 2030 focal points, and technical working groups are coming together to monitor progress, measure progress, report that to FP 2030 so that we can distribute that to partners around the world. It's the conversations that matter, the conversations in those countries where they're measuring progress. We now have a decade of data from 2012 to 2022 that illustrates that despite various and diverse disruptions and crises, including natural disasters, civil conflict, economic slowdown, epidemics such as Ebola and Zika, and now the COVID-19 epidemic, that despite all of these, across all regions, contraceptive use has grown. Today, there are approximately 1 billion women and girls of reproductive age across the 82 low and lower middle income countries. You heard the number 8 billion yesterday, so I want you to think about 8 billion people in the world. 1 billion are women of reproductive age in the 82 poorest countries of the world. We can celebrate success because more than a third of those, 371 million, as Dr. Samu said, are now using a modern method of contraception. That's 87 million more women than a decade ago. But there are many countries where progress has been far faster. In sub-Saharan Africa, the number of contraceptive users in the last decade has nearly doubled from 25 million in 2012 to 48 million today. So nearly doubling. In some countries, that number has almost tripled. And DRC is one of those that has seen this kind of rapid increase. But this isn't just about contraceptive use, it's about method choice. There are 50 million women who are using a traditional method of contraception. Rhythm, withdrawal, not yet a modern method. Do we know why? No, we're not sure why, but it represents an opportunity to meet them with information, with various choices, a range of methods that might meet their needs. And we've seen that in many countries where the options have increased, that uptake has been rapid. Back in 2017, when I did the progress report, we reported that only in one country, Burkina Faso, were contraceptive implants, long-acting implants, the most common method. So across all of the countries that we looked at, implants were the most common method in just one country. Now, 5 years later, implants are the most common method in 10 countries, and they are the second most common method in another 14 countries. That's the kind of progress we can see when we meet women where they are with the information and a range of choices. But meeting the needs of those 1 billion women is not simple. It requires the technical assistance of country governments, of civil society organizations, of technical international partners and financiers like USAID, like UNFPA, and so many others. So I want to alert you that our report also includes a section on financing for family planning. It covers a decade's worth of data on donor contributions to family planning. And as my colleague mentioned, this financing for family planning over the last 2 years is largely flat. We reached a peak in 2019 of 1.5 billion US dollars, and today we are at approximately 1.39 billion, or almost 1.4 billion. So as the number of women of reproductive age grows, and the number of women who want to use services grows, and our need to meet them with new methods grows, our financing from donors is flat and not meeting that need. So where will that come from? It comes from the advocates who will put pressure on donor governments to continue that financing and hopefully increase that financing. It comes from the financial commitments of many of the countries, and I hope the Honorable Minister will talk about the financing commitment that DRC has made, because it will come from domestic country governments. And it will have to come from the private sector. And we've seen commitments from Organon, from Bayer, that articulate what they can do to support a lower price and method choice across these countries. So our work is not done. I encourage you to reach out to us with your stories, with the data that you would like to see, and we can provide that to you, follow up in various reports and reporting. We will make ourselves available and look forward to working with you to tell this story to the world. Thank you.
Thank you, Jason. Before I turn it over to the Honorable Minister, I'd like to take a moment just to reiterate and discuss interpretation. We do have headphones now for everyone, so anyone who's listening on speakerphone, if you could please raise your hand and we'll hand you a headphone. Is anybody here? Maybe you can.
Est-ce qu'il y a quelqu'un ici qui a besoin de traduction et qui n'a pas reçu encore est-ce que vous pourriez garder votre main en air et comme ça, on va pouvoir vous passer des audiophones. Merci.
And also, when you are on the website, there are 3 options. There's floor, there's English, there's French. Please do not choose floor. Please choose English or French. If you are an English speaker, choose English. If you are a French speaker, choose French.
Vous allez voir sur vos téléphones qu'il y a 3 choix, anglais, français et fleur. Veuillez ne pas choisir fleur, mais choisir ou l'anglais ou le français.
Merci. Does everyone have a headset now? I'd like to turn off all speakerphones so it's not distracting for our speakers. We don't have Apple. Okay. Thank you for sorting that out, and thank you for that brief pause. Now I will, without further ado, I will turn it over to Dr. Jean-Jacques Mbungani Mbanda, the Minister of Public Health from the Democratic Republic of Congo. Thank you.
Okay. Merci beaucoup pour.
Thank you so much for giving me the floor. I hope that most of you can hear the English interpretation. I just want to say that it's a true honor for the Democratic Republic of Congo on my behalf to be able to exchange and share issues on the subject at hand, which is family planning and achieving the goals for 2030. To add to what Ms. Kemosadume said, we need to be bolder in order to create a better world for women and girls. In spite the health crisis, we need to persevere and we need to increase family planning, which is very useful for women's rights. Society's development goes hand in hand with family planning. In the Democratic Republic of Congo, family planning is also a priority for our government. And as I said this morning, we have the National Health Development Program in which contraceptives in 2030 should reach 30%. Family planning is part of the health package we provide in our universal health coverage. And we also have the option in our strategy to increase access for family planning and to increase access for youth, for teenagers. That way, they will be aware of family planning. In order to achieve this, we need the means. Since 2015, the government has had a line of credit to finance family planning. We took over this commitment because we need a commitment, and those $5 million per year in the framework of the FP 2030 initiative. So for the year 2022, we disbursed $1.2 million. For 2023, we have a line of credit of $5 million. But if we see from 2014, we had a budget of $300,000. In 2018, $1 million. 2022, $1.2 million. So we see a willingness from the government to invest in family planning. If we compare this to other countries, even though we face protection and security and health issues, these are huge efforts made by our government to contribute to family planning. Besides the national and state resources, we also have the option of having the means through mining companies. This is because the mining code of our country of 2018 compels mining companies that work in RDC to invest in social sectors. This is an engagement made by mining companies, which we believe will help our health sector and also family planning. We also have the option through well-known mechanisms to have the matching funds that will help RDC to increase the national investment and to attract more investments from partners to improve family planning as we are discussing today. I also mentioned progressiveness and the efforts increased of the country to have a larger mobilization in family planning, and the access of youth and teenagers to family planning will benefit as well a strategy. We have community centers in RDC where youth can exchange several topics. At the moment, we have 200 community centers out of 516 health zones. In Kinshasa, we have 80, and the others are spread in the Republic. There are indicators that show, as we saw in this morning's video, of two young Mexican girls and two young RDC young people to talk about the different methods of contraception. Digitalization also has a great impact because it allows us, through evidence, to guide teenagers and youth and to break down any rumors. One of the issues we have concerning family planning are the structural rules that does not allow good information to come in sometimes. In our school curricula, we also have the needed information for our students regarding family planning. That way, all students can grow up with family planning and make the best choice for them. Contraceptive methods in pharmacies and schools is also a rule. I mentioned some of the challenges when it comes to big cities. Information and the work flows better, or rather better than in the rural areas where we need more engagement. And this is where health staff comes in. We need to reach young people who are not in the circuit of community centers or hospitals. So there's a mechanism that was implemented to track all young people that are looking for this type of information outside the traditional hospital circuit. Also, as I mentioned, family planning is a crucial part of the universal health coverage in RDC, which is access to health without impacting our finances. On June 30th, we launched a project for free consultations prior and post delivery. However, we cannot talk about free maternity without increase in family planning. In my country, in average, a woman has 6.6 children, whereas in other countries the average is 5 children. So we need to break this cycle where women are delivering babies every year. So this is why family planning is so important, and I really must highlight that. So the challenges, we have limitations, and the government has provided options to invest more so that we can widen the access to family planning, a better communication to convey the information to shareholders, and to consolidate national funds and to increase our relations with our partners. I'd like to go back to what was said this morning and to recall what we just heard, which strengthens our interests today. Thank you so much.
Thank you, Dr. Mbanda. Now I'd like to open the floor for questions from our registered media. I'd like to invite you, if you have a question for our speakers, please raise your hand, and when I call on you, please stand, state your name, the outlet that you are representing, and ask your question and mention the speaker or speakers that you are directing it to. Thank you very much. And now we'll take questions.
Hi, my name is Sandhya Raman. I'm a healthcare reporter from Roll Call in Washington, D.C. in the U.S. My question was, given all of the new commitments that you've gotten, how far away are you from reaching the goal for unmet need, and what still needs to be raised to get there? Thank you.
Dr. Dubé?
Thank you so much for that question. So in terms of the commitments, I think we are almost like those which are being finalized and drafted and launched. We are at about 40, is it 40, 41 as of today, governments, and then we've got nearly 80, 25 launched. And then the ones that are being drafted and yet to be finalized, I think we're almost up to 40 that are being drafted. That for us doesn't necessarily measure what the real unmet need is, right? Because the need is about the women who are accessing family planning on the ground. So we are still nowhere near. In fact, today, from the UNFPA agenda, the number for unmet need, Jason, is
218 million women in
low.
low and middle income countries.
Yes. So we still are nowhere near that particular goal. And this varies per country. So we do hope that each country in their commitments, they do articulate what their unmet need is. And then they articulate the strategies on how they will work and ladder up to ensuring that they reduce the unmet need.
Can I just add? I do want to clarify on this question that FP 2030 does not have a goal on unmet needs. So to clarify, countries establish their own goals, and most countries are establishing goals that talk about providing services, a range of choices, and do not actually have specific unmet need goals. Happy to talk a little bit more about that afterwards. Thank you.
Thank you. We can take our next question.
Hi, I'm Amrita Bayatnal. I'm a senior editor at DevEx, and we report on global aid, across the countries. So my question is more about the funding aspect. So you said that you peaked at 1.5 billion in 2019. So what is the need right now? And where, can you talk a little bit about how that 1.5 billion or the 1.4 billion that you have right now is being used globally?
Do you want to talk about that?
Yeah, thank you. So just to clarify, that's 1.4 billion just from donor country governments. If we were to expand that and look at private foundations, important contributors, both to the FP 2030 partnership and to the global funding ecosystem, that's approximately 1.8 billion of donor contributions for family planning every year. Putting that together with what countries spend and what consumers spend on family planning, as a whole, we estimate in this year's report that in low and low middle income countries, we're spending $4.2 billion US per year to provide services to the 1 billion women that are in those countries. That money is not spread evenly. And in some countries are spending incredible amounts from their own coffers. India, Indonesia, Bangladesh, and others are spending from their own. And then other countries are still dependent on donors. And so what we have to look at is not a total amount, but we encourage through financial commitments like that made by the Honorable Minister, that every country make a plan, a financing plan that includes a contribution of donors, as mentioned, matching funds, contributions of the government, and expect that those people who can pay in a country will be paying, those can afford, and using mechanisms like health insurance and others through our pursuit of family planning being part of UHC. So I think rather than focus on one large number and how much we're spending, our regional approach and our country approach is to understand every country and their family planning financing plans and a sustainable path for each country. Thanks. I hope that answers your question.
Thank you. And call in another question from, yes, Chibuke.
Thank you for your time. So my name is Chibuke Alaboso. I work with Nigeria Health Watch. So my question is actually two ways. The first is, what's the accountability framework like for these commitments? Because I know there are competing interests and needs, but then how do we make sure that these commitments are not just statements that these countries actually work towards these commitments? And the second one is, so there are important global conversations happening alongside the ICFP, the COP27 in Egypt, the G7 summit. And, you know, in some of these conversations, that connection with health and climate change has been made, for example, in COP26. And again, we are hearing here that there's a connection between family planning and UHC. But how do we get them to understand that connection between family planning as well and climate change, that it's sort of a foundation for all of this, you know, family planning and climate change? How do we get these leaders to understand this? And if there is evidence, so that would be Jason, if there is any evidence to support that, because these are the things that can help them understand these issues and their urgency. Thank you.
Thank you very much for that question. Thank you very much for that question. So the first one around the accountability framework. So FP 2030 launched an accountability framework that countries could use to sort of track some of their commitments. There are various mechanisms that we use for this commitment making process and operationalization to ensure accountability. The first one is on how that commitment is generated in the first place. So we use and we encourage countries to utilize a focal point structure that has got civil society involved, that has got youth involved, as well as government and maybe donor organizations there. We are seeing that going to expand in the future to obviously include some of the people from other sectors. For example, people who may come from private sector or people who may come from the humanitarian setting, so that is robust engagement in country. The second layer after that commitment is made is operationalizing it through CIPs, which is a toolkit to make sure how do you make this reality of your vision to actually get it into action. So that process on its own entrenches accountability. The second one is data. Jason here, leading our data and measurement team within FP 2030, works with others in the PMA working group to make sure that in each country they have some do it quarterly, some do it monthly, to make sure there is that data visibility in country in the operationalization of the particular commitment within their family planning strategies and others broadly in the reproductive health strategy. That data is then put together, and that's what Jason is actually whetting our appetite on what that global data looks like, but it actually is generated from in-country. That whole process of around data visibility is also entrenching accountability. And also in some countries, they come together through the motion tracker to understand what is happening in each country. So each country has got a different operationalization of this accountability framework. But accountability for us is what should happen at a community level, at a country level, but at a global level. That is important. And I know where this might come from, that often we make commitments at global levels which may not be operationalized and followed through at a country level. And we're making sure that this accountability framework actually enables countries to do that and make sure they do commit to what they can achieve at a country level. I hope that answers your question. The second one around the parallel dialogues. Indeed, we have said that family planning is a glue that brings this together. We were speaking earlier with Atu about UHC. For many countries, the universal health coverage enables women, as they're accessing family planning, not to suffer financial distress. But in some of the countries, we know that it has been slow progress to get to UHC. So we are engaged in the dialogues and strategies for UHC to ensure governments also include private sector within their UHC agenda and ensure that they could measure and do itemized billing on what a family planning implementation plan would look like under UHC. Within that, we want to encourage governments to expand method choice within a UHC agenda. So FP 2030 convenes such dialogue, enables people to come together to discuss what that strategy could be, and then they can operationalize it in country. Lastly, right now with climate change, we are convening that dialogue to say, we cannot deal with climate change without involving women, without giving them the tools to recover from disasters, conflicts, and many of the things that they are facing in the country. So that's why these are intricately linked. We want to shy away from conversations that say, yes, we're celebrating 8 billion. We see that as 8 billion opportunities if we invest better in women. So it's not just about, climate change is linked to family planning because of this, but climate change is linked to family planning in that we want to make sure that women can recover better and women actually are enabled to be more resilient as they face climate disasters when we enable them to do so. And these dialogues are ongoing in terms of that linkage between family planning and climate change. And as we speak in Egypt, I did give some remarks about why it's important for the sectors to actually speak to each other. Jason, you want to join?
Fortuitous that before my time at FP 2020 and FP 2030, I worked on family planning connections with climate change. Happy to talk about those more. I will say that we have some important commitment makers to FP 2030 who are at COP27 right now. They had to choose. And it's a shame that they have to choose, but they had to choose. Should we go to the Family Planning Conference? Should we go to COP27? I've been reading the messages from them. They are, I would say, waving the flag and saying family planning can be a transformative approach for women's resilience and adaptation to family planning, to climate change, and there's a large amount of evidence that shows that. So we're just happy that those conversations are happening here, and there are conversations at this conference as well on those connections in some of the sessions. So while we're not talking about it today, it is exciting that we have some commitments from organizations that are working across this divide.
Thank you. We have a related question from one of our virtual media. As we're talking about COP27 in Egypt and the G20 in Bali, this freelancer would like to know what specifically you would tell these leaders they must do to place family planning to play in addressing crises and advancing sustainable development goals. Dr. Sa-
That do you want him to respond?
Sure.
What DRC is doing, maybe?
Yes, please.
J'ai pas bien compris la question.
Si vous voulez, monsieur, je pourrais traduire la question.
Il faut répéter la question.
La question.
Oui.
Oui. Alors, la question, c'est si vous auriez l'opportunité de parler avec les chefs d'État qui sont dans les grandes conférences en Égypte et au Bali, qu'est-ce que vous leur diriez qu'ils doivent faire spécifiquement pour avancer la planification familiale comme outil pour adresser les crises dans lesquelles ils sont en train de parler là-bas?
Merci. Merci pour...
Thank you for the question. First of all, I think that all ministers who had the opportunity to be present at this conference, we need to call upon all countries to place family planning as a priority. RDC, as I said, family planning is one of our government's priorities. As long as more countries place family planning at the center as a priority, we will be able to fight against against climate change, and it's just to call upon all governments to add in their politics family planning as a priority. Family planning goes hand in hand with society's development. I also have a comment on climate change. Women are at the center of family sustain in many countries. So if we don't have family planning, we know that it's in direct link with climate change. That is undeniable. And women are a development tool, so we need to educate them and help them to manage their reproduction and sexual rights. It's a priority that we need to set forth.
The room from our registered media.
Can I just add to what FP 2030 is asking countries to do? So we are asking countries as they make these commitments to make sure that they do make the intersection between family planning and other sustainable development goals clear in their articulation of their national development plans. Many countries have got elaborate and great national development plans. For us, we demonstrate how family planning ladders up to all of these. And so as we engage with governments, we try to ensure that, you know, we could have dialogue with both the ministers of health, ministers of finance, ministers of economic planning and development, ministers of women, and at times ministers of education, so that they all see how family planning is a glue that brings this all together to advance these goals. For we believe there cannot be development without family planning. Neither could we program family planning better in an environment that is devoid of those developmental goals. Thank you.
Thank you. We do have another question from a virtual media participant, but I'd like to invite the floor to see again if there's any in-person questions. Okay. This question is for Jason. The question is from a freelancer. His name is Benedict Tembo. What is the situation with contraception in Zambia? What are the success stories and what are the challenges? What are the opportunities? What are next steps? And I would also invite you, we can follow up with him later. We can talk about that at a high level, and I'd also like to open that question up to the region of South Africa more generally.
Well, I'll let my colleague from the southern region of Africa speak to, I think, general opportunities and challenges. I, in general, talked about the increase in contraceptive use in sub-Saharan Africa, and Zambia, in particular, has seen great progress over the last decade. The number of contraceptive users in 2012 was about 1.1 million. That's grown to 1.8 million today. So 1.1 million in 2012, 1.8 million today. I mean, you know, let's just do some rough math. You know, there were 1.1 million. Now you've added 700,000 users in 10 years. That's an accomplishment. I mean, imagine just, you know, if you're a restaurant and you have to serve twice as many users, you know, and they come back again for services, because it's not just once that you serve them. They're coming back for services, for supplies. So that's an accomplishment. I know that Zambia will, in terms of their commitment to FP 2030, they'll be seeking to do more, and we'll aim to support them in that effort. I think follow-up questions on Zambia in particular, I'll work with our regional office, because really our regional hub is here now to support that dialogue and that conversation. I'll ask Samu, who was in the region not long ago, to talk about her experiences.
Sure. Thanks for that, Jason. And Bwanji Tembo online, we are looking forward to going to Zambia. In fact, we're not successful, as it was one of the countries where we needed to sort of galvanize a commitment from. I'll also talk in that realm, Kirsten, because you did mention South Africa. We have been trying to get a high-level representation from South Africa, and we do hope we will be successful as we continue to push. The countries generally, in terms of prevalence for family planning, is a little bit higher, and we are seeing progress there, but there are different challenges. All countries are different. So most of the countries in Southern Africa are facing high levels of teenage pregnancy, which is something that we need to tackle. The other issue is HIV. So we need to integrate HIV and family planning in our strategies going forward. So Tembo, the strategies that we need to advance, perhaps are strategies around dual prevention methods, which for me is key for women, and also acknowledging that women are also accessing contraceptive technologies from private sector, even in those regions. So those are the strategies that we are seeing emerging from the region. And lastly, in terms of the leadership from the region, I think we are seeing more collaboration that is coming from countries supporting each other to make these commitments. But I must say, we are still waiting for the commitment from South Africa. The one from Zambia, I think, is being finalized, but there is an active youth movement there, which is Copper Rose, Zambia, led by Faith and is it Natalia Kaoma? and they've been really pushing even with the UHC agenda, and we must commend them. So I would say, Tembo, please get in touch with Faith Kaoma, and we are looking forward to our visit in Zambia so that we galvanize all involved and who need to be part of this journey in Zambia to make a commitment. Thank you.
Thank you, Dr. Samu. This now concludes our news conference for today. Thank you all for your participation and your attendance. I will remind you that we do have copies of the press release about the new report. We do have also a briefing book about the report. And I'd like to invite our speakers to go over to the step and repeat for group photos and individual photos. And if anyone would like additional statements or interviews, that can be accommodated as well. So thank you all for your time. We appreciate it.